Yes, I'm Dr. Louis Sovey, and our webinar tonight's on minimally invasive options in plastic surgery. And Dr. Reyes, Hanny Reyes, will start the presentation. The first 90% will be his minimally invasive procedures he does a lot of. And Dr. Reyes and I have been together now 5 months, and I'm very glad to put on this presentation. Go ahead, Hanny.
All right. So for those of you that haven't met me yet, I'm Dr. Reyes. I'm Dr. Roby's new facial plastic surgeon. Very excited to be here. It's been a very good first 5 months and looking to build on what we've already achieved. So this is a picture of our clinic. For those of you who haven't visited us, it's a 12,000 square foot freestanding facility that includes a surgery center, the Pangenic Center, our clinic, and the Renaissance Center, where we do a lot of our minimally invasive procedures. So what are we planning on covering today? So these are the objectives of our presentation. We're going to go over basically minimally invasive procedures that don't require you to have an IV, can be done quickly, and are ideal for this time of year around the holidays. So we're going to talk about Botox, fat transfer to the face, filler, eyelid surgery, eyebrow surgery, our unique slim lipo platform, skin resurfacing, and stem cells, which is unique to our practice. So what happens when we age? I like to summarize the aging face into the 3 Ds. It makes it easy to understand, and you can understand what treatment does for each one of these Ds. So the first one is drop. Basically, things drop down from where they normally were, or sagging, and that's due to a loss of elasticity in our tissue. The second aspect is deflation. Areas that were normally fluff and filled with good volume, you can imagine a baby's cheeks, normally then they get deflated over time due to fat atrophy and bone loss. So that's a deflation. And then deeper wrinkles. So as we age, you get wrinkles happening.
I'm fine.
If you don't mind muting your
Okay, hang on just a second. I've got a okay, let me just mute my thing. Okay, I'm in the middle of a webinar. That's fine. I'm more interested in what you have to say.
Okay.
Yeah, I just put it on mute. That's fine. It's being recorded. It's okay.
You can mute your microphone, please.
Yeah, please.
No.
Let's get through our presentation.
Who is this?
So yeah, and then wrinkles.
No. Where did you get it? Okay.
Pretty sure it's Barbara.
Oh, wow.
Would you please mute the mic? How come you're live?
Okay. Right.
Nick, you should be able to see who's talking.
Oh,
There she goes.
Why don't you go ahead with your presentation?
All right. So the first thing we're going to talk about is Botox. So it's a neuromodulator, and basically the reason that we use it is because to help prevent wrinkles. So our wrinkles form parallel to muscle contraction, and normally they start off as dynamic, basically when you're moving your face or those muscles, and as you age, they end up becoming static as the skin starts to develop these deeper wrinkles. So Botox is the most common neuromodulator that we use, and basically what it does is it paralyzes muscles. So a fun fact about Botox is that it actually is derived from a bacteria called Clostridium botulinum, and you can get it from eating honey. Although that's very rare if it's unprocessed, but that's just a random fact about it. And it relaxes the muscles to help treat wrinkles in between the eyes and the forehead especially. And here's a patient who had Botox treatment to her glabella, which is this area over here in between the eyebrows and forehead. And you can see that the muscles are more relaxed and wrinkles get smoother. It helps as a maintenance therapy also, so getting it done helps weaken wrinkles that are already there. And people often start getting this procedure in their later 20s. So what are the changes that happen in the midface as we age? So the midface, basically going from just under your eye to around your mouth, you can see that you have deflation. Basically where you had fat, it gets loses volume, and descent. So this helps form these nasolabial creases and the jowls. So for the deflation that happens in the midface, we have two main options to treat this. The first option is fat. So fat, we have a specialized fat grafting technique over here. We often combine it with PRP. We harvest the fat from your own body, typically from areas where you find it hard to lose weight. And we place it in large volumes to help restore that volume that's lost. Then the second option is filler. Filler, it's a synthetic material based on a natural product that's in your body and is good for fine lines and fine tuning wrinkles. So first we're going to go into fat grafting in a bit more detail. So fat is like liquid gold. It can achieve long-term results in patients. What we typically like to say is what you see at 3 months is what you'll see long-term. It can create a sort of non-surgical facelift. So if you're not looking to undergo a full facelift where you have the incisions and the lift, the fat is a temporary alternative that can help fill in the areas of deflation. Obviously, it doesn't lift up, but it can help give you a more rejuvenated look, especially in the areas of the midface, where large volumes of fat are much more cost-effective than placing fillers, which are more temporary in their longevity. So the specialized technique over here at OB Plastic Surgery, we use the Invasive machines, and it helps basically get fats that's high in stem cells. And this high concentration of stem cells provides a rejuvenative effect as well as replenishing of the lost volume. And like I said previously, what you see at 3 months, you'll see long term. So it's a more permanent solution for large volume loss compared to filler. Over here, you see a patient.
This is a patient that's published in the first book ever published on stem cells and aesthetic or cosmetic surgery. And this lady had approximately 50 cc's of specialized fat grafting, stem cell concentrated. And you can see when Dr. Reyes clicks on the space bar, the results. And that's you cannot use that volume of synthetic filler in the face. And with this technique, there are different degrees of concentration of stem cells. When you go all the way to pure stem cells, you get a better take long term. And which, like Dr. Reyes said, which you see at 3 months, you'll see long term. And I've had this lady is about 7, 8 years out.
You can see the rejuvenated appearance around her eyes and in her midface.
Another one of my patients that long-term results.
So synthetic filler, basically the meaning is in the term. It's a synthetic material based on hyaluronic acid, which is actually a substance that we have naturally occurring in our body, and it helps provide kind of like strength and support to skin. The hyaluronic acid can be reversed if the need arises, although that's very rare. It's good for fine lines, so basically around the mouth and under the eyes. And filler is purchased by the syringe. So two main companies produce the filler. You have Allergan, which makes the Juvederm products, and Galderma, which makes the Restylane products. So filler placement, I mean, the ideal places where filler works most effectively is over here in the creases around your mouth, in your marionette lines between your lower lips and your jaw, and in your tear troughs. Over there, these are more delicate areas, and it can help smoothen out the differences in volume between the cheek and the thinner upper lip. So over here, we're going to show an example of lip filler. And for the lip filler, we use Volbella, which is a thin product. We use a topical numbing medication, which works very effectively. As you can see, the patient's barely feeling it. And we kind of place it just to enhance your own natural anatomy. We don't try to distort you or give you funny duck lips. And as you can see, I mean, it's a very nice, subtle result.
Pause it here, Annie. What's over here, Lindsay? This is our patient that Dr. Reyes did. You can see her in person. So was there very much pain or?
No, not at all. They numbed me actually very, very well, and I barely felt it at all. It was kind of like pressure, no pain.
Yeah, good. Okay, we just want to see her in person. Okay.
Yeah, thanks.
Okay, I'm sorry, Annie.
Oh, no problem.
That's a good testimonial for you. Okay.
It is.
Did a good job, Annie. We also did some stem cell fat and PRP around our eyes. Now, this is
the under eye filler.
Amazing results here.
And for the under eye filler, we're a bit more careful when I do it. So I dilute it because the eyelid has the thinnest skin in the body. And again, we use the same topical numbing cream that works nicely. And you can see it helps to blend out the lower eyelid bags. Here's another example of under eye filler. You can see the hollowness that happens under the eye, which is just a normal consequence of getting older. And putting in the filler helps blend the junction between the eyelid and the cheek.
Great result.
Yeah, it takes, thank you, Doctor. It
And
gets
you
rid of
can
the
see
shadow.
neither one of his patients were moving when he was injecting the lips and the eyelids. He does it much better than I could ever do it.
Thanks, Doctor. Yeah, we have a good topical numbing cream. We try to minimize pain. So now going into other minimally invasive procedures that we can do, basically just with some oral medications. You don't even need an IV. So in the upper eyelid area, this is where a lot of people come and tell us they feel like they look older and that they've aged, or that they have a tired appearance when they really don't feel tired. And that's because you have drooping of the eyebrow, especially in the tail of the brow, where there's less support. It drops down and kind of creates a fullness. You have excess skin in your upper eyelid, and you can get loss of fat, creating a sunken in appearance in your eyes. So there's numerous options that you have that can help and treat this. So we start off with the upper eyelid excision. We basically remove the excess skin from the upper eyelid and any excess fat, and that can remove some of the redundant skin. And then one of our unique and kind of trademark procedures that we do over here is the LJO brow lift. So it's a supraorbital brow lift that Dr. Obi developed and has done thousands of patients, and I'm currently doing them as well. And basically what it does is you have an incision over here hitting the tail of the brow, and it's in the eyebrow hairs. You do not lose any hairs from this, and it really disguises the scar well. And when it heals, people won't even know that it happened. And this can be performed under local anesthesia using a Valium pill to relax you. No IV is needed, and you can barely feel and it's a pretty quick procedure to have.
Now that's the patient you did?
Yes.
Okay. Dr. Reyes, I told him I do the brow lift, and he did both of these procedures and picked it up very quickly.
Yeah, and you can see it removes the redundant skin, helps lift the eyebrow, and none of the scars are perceptible.
And this one is a combination. I did this lady many years ago. I did the LGO brow lift in the upper eyelids, and also added some stem cells. Again, replacing the deflation, the lost soft tissue from deflation of the face. And you combine all these. This much surgery requires a little sedation, but the LGO brow lift and upper eyelid surgery can be done without an IV.
Yeah. And yeah, these are all procedures that have minimal downtime and minimal bruising and healing afterwards. So the next thing we wanted to talk about was slim lipo. So there's numerous liposuction platforms out there, and I'm sure a lot of you have heard about them. But what's unique to our practice is the slim lipo. So the cool thing about this laser is that it uses 2 wavelengths, and it's the only device that causes skin tightening. So the 924 nanometer wavelength is specific for fat cells, and it melts the membrane of the fat cells. And the 975 nanometer coagulates blood vessels, which minimizes bruising, but it also tightens the skin. So this means that in the area where the fat's gone, you kind of have a dead space or a volume loss. By tightening the skin, it allows the excess skin to contract over this area and helps give you a nicer contour, which is one of the hardest things to achieve with liposuction. People can go back to work in 2 days, and it can be used in many different locations for the muffin tops, the abdominal area, and around the neck.
Yeah, we did 2 major cases today, breast, and we integrated the slim lipo platform. And Dr. Reyes is picking this up very quickly. It's a lot of work, so I'm glad he can do these.
I wanted to talk to you guys.
The neck, this is an actual procedure that I did about 7 years ago. No, I guess this is 12 years ago.
Yeah, and we're going over the
Yeah,
procedure.
one of the first ones. This is a demo tape we did 2000.
This is showing you our markings where we put, and so we start off with an infusion. This is the numbing medication, and then that's the laser going in. Again, it's 2 wavelengths. One melts the fat, one tightens the skin. This can be done under local anesthesia. You don't even need an IV, and we use we suction out the excess fat after we laser it. And then we use ice saline, which helps to minimize bruising afterwards. And that's us putting in the saline irrigation that helps minimize the bruising.
95% of patients have minimal to no bruising. This is only less than 24 hours later, and no other technology will accomplish this unique, really vivid results overnight.
You can literally go back to work the next day or the day after. For most other procedures, you're down and out. It's another slim liposuction of the neck before and after. It works very, very nicely in the neck and can be done under local anesthesia. And you can see that much nicer contour for her jaw and her neck. And again, another dramatic result using our slim lipo technique. So over here, we're going to talk about the opera lift. So the opera lift is a non-surgical facelift. It combines the fat grafting technique that we talked about earlier with slim lipo of the neck. So you have no surgery and no scarring, very minimal downtime. We like to refer to it as a 3D facelift. You can add PRP and that helps enrich the outcome. Here's an example of a patient who had the opera lift done, where she had high volume, large volume fat grafting, along with slim lipo of the neck to tighten it.
And to my knowledge, she looked like that 6 years later. Opera lift is an acronym for Obi Palomar External Rejuvenational Aesthetics. It was a catchy term, acronym that I used when I was teaching back when Palomar was very active with these techniques.
This is the combination of treatments showing less shadowing around the eyes, combining the fat grafting with the brow lift. And the key thing is that a lot of these procedures can be combined to be done under local. Patient tolerates it well, goes home comfortably, and doesn't have any of the lingering effects of anesthesia, such as nausea and being tired for the day. So lastly, when it comes to aging, we like to talk about skin rejuvenation. So many of you are bothered by wrinkles that happen in your skin, especially living down here in Florida, where a lot of people get early sun exposure and don't really take good care of their skin when they're younger, only to realize the effects of it when you get older. So young skin, you can see over here in the example, it's thicker, it's got a nice layer to it. And then as you age, you kind of get these deep crevices because you get thinning of the epidermis, thinning of the dermis, the skin gets weaker, loses elastin, it loses collagen. And that's why you get the wrinkles. So what can you do about it? The first thing is to get on good medical grade skincare. You can using an exfoliator, cleanser, Retin-A. We have prescription strength Retin-A that really helps. You got to start slow with it because it can kind of have a drying effect on the skin. But once you get used to it, it can really help kind of rejuvenate your skin. Using effective sunscreen, at least SPF of 40 when you guys go out, can help. And then we have options to rejuvenate or resurface the skin. Lasers and chemical peels are the two different options that you'll find when you look into this. So over here, we use the TCA chemical peel. And it's an old technique, but it works extremely well. So we use a 35% TCA. And basically what it does is it removes the top layer of skin. So it's an acid and it coagulates the outer layer of skin. And when your body heals, it regenerates with a new layer of skin coming out, helping to shed that old skin that's got the wrinkles in there, and pores, and those sunspots. So it's ideal for the deep wrinkles around the mouth, if you have fine wrinkles under the eye that are hard to get rid of. We normally do this in the office, and most people actually don't require any sort of medication to sedate themselves. When you're having it done, it kind of feels like a bad sunburn. And your skin will peel for 7 to 9 days after. Taking care of that is pretty simple. All you have to do is just keep it clean. It's much more aggressive than a laser can be. And it's actually safer than a laser because it can't burn you. And the way we stop it is we just neutralize it with tap water while you're here in the clinic. And this is an example of a lady that had a chemical peel done. You can see great improvement in the sunspots that happen, those pigmented lesions that happen just from being in the sun, and improvement in the wrinkles around the mouth.
This was done about 30 years ago, and we actually did a touch-up peel also. But long-term, she looked like the picture on the right.
And that's the key thing about chemical peels. Even though they've been around a long time, they're still probably the most effective way of resurfacing the skin. There's all sorts of lasers, including resurfacing, non-ablative, ablative lasers, and basically they compare themselves to the gold standard of chemical peeling in terms of skin rejuvenation.
Less expensive too,
It is less
Yeah.
expensive, yeah.
but it's safer.
So to summarize what we talked about today for rejuvenating the aging face. So for lost volume, the deflation, you have two real options. Filler, which is good for small volumes under the eyes and the lips and around the mouth. And then specialized fat grafting, which is good for large volume replenishing, such as replenishing your mid-face area, your temples, your chin, and around your jaw. For the upper eye area, you have the patented LJO brow lift, which helps to lift the tail of the brow, upper eyelid blepharoplasty. All these have minimal downtime and swelling. And for skin rejuvenation, getting on a good skincare regimen early is critical, including Retin-A and good sunscreen. And then if you are bothered, now is the time to do a chemical peel, because not a lot of people aren't out in the sun, and usually we like to do chemical peels in the winter months when you can avoid being in the sun to allow your skin to heal without the sun also being exposed to the sun. So if you guys have any questions, write them down. We'll answer them at the end. And Dr. Roby's going to talk a bit more about.
Let's switch chairs. Just want to say it's been a pleasure having Dr. Reyes. And when he joined my practice, all of a sudden we developed. This is a dream, a vision I've had of a dream center for at least a decade. And we actually, with Dr. Reyes joining my team, we will move forward with this next year. So how do you change this? Just push it. Okay. So anyway, this is going to be our new stem cell pangenesis regenerative center. And yeah, we had this stem cell presentation last time. And there's a lot of talk about stem cells, the different types of stem cells. And 99% of stem cells are located in our superficial fat. At birth, we have like 306 trillion cells, stem cells, and there are 4 different types. And the best type to use is Schwann cells underneath your skin. You can actually almost see the cells here underneath the skin. So I went the wrong way. Okay. So anyway, this is that was a picture in our laboratory with growing stem cells. It's a mononucleated cell that has the ability to multiply, divide, and it's undifferentiated, so it can form any tissue type almost. And this is a cluster of stem cells that's in a colony. And so anyway, we were able to grow them. So again, I kind of told you what a stem cell is. There are different types. There's mesenchymal stem cells from fat or connective tissue. There's hematopoietic stem cells in bone marrow. There's cord cells, and there's embryonic cells. The only type that you can really, or that's effective, is from your own fat. Bone marrow is good for regenerating blood elements, but they have such small numbers of cells, they have to expand them. Cord cells, the US have no live cells, so cord cells are highly touted by, I think, providers who doing it just for the profits, and it's not a good way to go. Superficial fat's your best bet. Again, this is what a stem cell is. It can replicate, it's an undifferentiated cell, and it comes from different tissues, and they can do a lot of things for us. In Korea, I worked with Dr. Hee-Young Lee in Korea, and Dr. Lee, actually, he's the one that taught me, he and Stephen Wong, they actually introduced me to their system, and they taught me how to produce stem cells from fat. And we've been doing this for about over 10 years now. And in Korea, they have the lowest death rate in the world. We have the highest death rate because we're not allowed to use the drugs and medications that they're used in Korea, nor can we use the stem cells. So I told you the 4 types. You go to the next one. And this is what we use it for in our clinic, mainly degenerative diseases, osteoarthritis, orthopedics, not so much. We don't do it for heart. We can treat COPD. In urology, it's used for interstitial cystitis, erectile dysfunction. Neurology, it's used in many just degenerative neurologic conditions like MS, Parkinson's disease, and other degenerative diseases of the brain. and mainly in cosmetic surgeries where I've used stem cells over a long period of time, 20, 30 years. So it's again derived from fat. And we formed the Pangenics Regenerative Center with multiple specialists, and we do this in a controlled environment in a licensed center, and we have a database of thousands of patients, and we've never had a serious complication. There are different degrees of success with stem cells, and so it's today we did a patient who's in his 40s with a bad ankle injury, had post-traumatic osteoarthritis in the ankle. Tomorrow we have a patient in his 70s with facing a knee replacement. Instead of that, he'll have stem cells, and we're successful by 80% of the time. And so it's easy to harvest. It's 36, actually 38 steps, and we count ourselves. In contrast to other centers, we verify the cells we have, how many cells, and we know how many cells are alive. You can usually produce up to 80 million cells. Most often we produce anywhere from 3 million to 60 million live cells. You only need a fraction of that to be effective. In bone marrow, you're lucky to have 10,000 live cells from 2 ounces of bone marrow aspirate. So anyway, we've done a lot of studies. We do a baseline based on functionality, based on MRI changes, and in some patients you do see increased joint space and with the stem cells, and so the degree of effectiveness with these is around 80%, and with other joints maybe a little less, but it's most commonly used for knees, hips, ankles, shoulders. Shoulders, I had my shoulder treated about 6 years ago, and I'm still have a very functional shoulder. So there are no serious adverse effects. We've had almost 3,000 patients with no serious complications. So this is our webinar code that you want to take a picture of.
Yeah, so this is our webinar code. We've extended it until if you book before Christmas, you get 10% off any of the different procedures we discussed over here.